Hey guys, Jared Beckwith here. In today's video, we're going to look at an EEG of a 52-year-old who had a brain hemorrhage and they're intubated in the ICU. They've been having some twitching movements, so one of the doctors consulted with neurology and they want to evaluate to see, are these twitching movements related to seizures? So when they first hooked up the EEG, this is the pattern that we saw. And when you look at it, you can see in the frontal electrodes, you see this delta activity, so the slower waves, less than 4 waves per second. You see this delta activity, and it may even be a little more prominent on the left side, but it's bifrontal on both sides in the front. It's rhythmic, so it gives me a little bit of cause for concern. And it also did the doctor. So I guess the EEG tech called the doctor, told him they see some rhythmic delta, and the doctor decided it would be a good idea to do a trial with a medicine called Ativan. So around 4 minutes in, we're coming up on the point where the doctor called the nurse, and they had the nurse administer 2 milligrams of Ativan just to see if it improves the pattern, because this patient was already on an anti-epileptic drug called Keppra, but sometimes the doctors can also add on drugs like Ativan, a benzodiazepine, to help treat seizures in the acute setting when you can notice something happening right in the moment, like we do now. So they gave the Ativan, and as we scroll a little more, the pattern still stays the same, but as we go a little bit farther in, it starts to die down a little bit. It's not as high amplitude. It doesn't look as sharply contoured or as scary now that the Ativan's kicking in and it's getting rid of that repetitive rhythmic delta activity that we were seeing in the front of the EEG. And when I was looking through the report for the doctor, it said that they thought that initial activity was probably a seizure, which makes sense to me. Rhythmic delta, usually a bad thing in a patient who's awake. And especially since the Ativan helped it, that kind of helped confirm, yeah, maybe it was at least abnormal brain activity, and we were able to treat it with the Ativan. Thank goodness, guys. So one thing to look at now that the rhythmic delta in the front is gone, it's lower amplitude. We're starting to see a little bit of faster frequencies. That could be from the Ativan as well. You'll see more beta type frequencies from benzodiazepines. And one interesting thing is, if you're monitoring a patient like this, whether you're a doctor or an EEG tech, you can, once you have a patient's seizures, you can look at the trends of the EEG. And in the beginning, when the seizure was started, it looked like this. And then once the Ativan was given around 4 minutes, you can see it kind of die down. The seizure just died down. And we just have pretty much just generalized slowing, which isn't a great pattern. But considering the patient was already unresponsive, we at least improved from this initial pattern. So if you're monitoring the patient over 24 or 12 hours, you can look for this exact, it's like painting a picture. This is a picture of this specific patient's seizure. Now, if it comes back, then you just give the doctor a call. They can administer some medication and get rid of it. If you look at the amplitude, it was initially pretty high from that high amplitude rhythmic delta. They gave the Ativan around here, and then the amplitude died down as it calmed down and became a little bit better of an EEG pattern. Now, this is definitely great for long-term monitoring and can make your life a lot easier. So just so you don't miss anything. You don't want your patient to be seizing and have them cause any more brain damage than they already have, because a patient like this with an intracerebral hemorrhage, it's not looking so good. So we have to do our best to stay vigilant and catch any abnormal brain activity, relay that information to the doctor, and give our patients in the ICU the best treatment possible. I hope you guys like this EEG record review. Hope you learned something. It was interesting to see it improve with the Ativan on not only the raw EEG, but the trends as well. It went from more of a broad range of frequencies to more of a narrow band range of frequencies. The amplitude went from high to low. And that, my friends, is this EEG of a patient in the ICU with an intracerebral hemorrhage. Thank you all for watching. Hit the like button if you like this video. I'm really excited to make more of these for you guys, and I'll see you all on the next one.